Welcome to another one here on the Mateo Franco DC channel. This video is going to be health and chiropractic specific. If you guys haven't already, smash that like and subscribe button. We're going to go over lots of things in health in this video. We're going to go over x-rays, why I talk about x-rays so much, and how that correlates to our health. So we're going to go ahead and dive right into that. So from the beginning, we need to define what health is. I always ask people, how do you know if you're healthy or not? And the majority of people that I've talked to will say how they feel and how they look. And I say that's a very broken model. How do we know that? We're building more and more hospitals, right? If we wait until the problems arise and then try to fix them, that leads to poorer health, right? So health isn't purely based on how we feel. Heart attack is a great example. You feel great, and then right once the heart attack comes on, you don't feel so great. But there's a dysfunction that was there long, long before we ever had that symptom. So we're going to dive into that. I always say too, I don't know anyone that wants to be healthy that doesn't want to feel great. So it is an important part of health, but it's not the most important. So we're going to dive into that here. The definition of health is the body's ability to adapt. Highlight that word, adapt to physical, chemical, and emotional stress, and its ability to recognize itself from the environment. That covers immunity. Okay. And we dive into that on different videos. I'm not going to spend too much time on that. Important note for us when it comes to our spine is approximately 15%, 15% of those nerves are based off of what we feel. The other 85% is based off of function, nerves that we don't feel. That's why we look at x-rays. That's why we do functional tests when people come in. I always say, looking here, you can see this. Let me grab my pen here. This area right here is super degenerative. I always tell my patients, if you felt this coming on, you'd have to be crazy to wait until it was this bad to come in and get this solved, right? This isn't based on how you feel. You don't feel the degeneration happening, right? Until a symptom arises. And then if you don't take x-rays and you just go in, and it's what I call patchwork, right? It's still better than drugs and surgery. If you go to some place that just hits the high one, hoping and praying that it works, right? You're not going to end up at a good spot because you have no idea if you may be feeling better, but eventually that's only going to work for so long. If you keep doing the same song and dance, eventually this degeneration is going to get worse if you don't have a plan to not only get you feeling better, but get that body starting to regenerate faster than it's degenerating. And that's why in our practice, we don't do a pay per visit. We don't do, you come in whenever you feel like it. That's not what we do. We're a specialty clinic. The reason for that is we're going to save people time, energy, and money, but we want people that want a great quality of life, right? And we have to plan. That's like saying they're going to have a great abundance in finances without financial planning, right? It doesn't make sense. And so let's take a look at this here. And I always show people this. Let me show you this. I'm going to clear these drawings here real quick. People will always say, well, I heard that the body can't degenerate. Once these discs are degenerative, that's why I'm stuck. And this is what surgeons will tell you. Just wait until it gets bad enough and then come in and get surgery. I'm like, what? So look at this person here. They've got significant degeneration in these areas right here. I'm going to change the color. If we come up to this area, we can see a pretty healthy disc, right? Degeneration is not caused by age. How do we know that? This person only has one neck, right? This is degenerative. This is not so much degenerative. Why is that? It's not an age thing. Otherwise, every single joint in their body would have the same amount of degeneration. It's a stress thing. That's why it comes back to that definition of health: physical, chemical, and emotional stress, right? We've got to get this area moving. That's how it regenerates over time. And we take progress x-rays, right? I want to know that people are feeling good. I want to know where they're starting, first of all. And we want to make precision adjustments. That's A of why we take x-rays. I want to know where they're at, what's causing the problem, if it's spine related, if we're going to have a high success rate with it. And then once we know the answer, we're going to lay out a plan for that and then make precision adjustments to help people heal as efficiently as possible. But right, looking at this, they're not stuck this way, right? Degeneration here, their body can regenerate. Until you're 6 feet under, your body's regenerating every day. If you look at how many cells in your body regenerate, from skin cells to heart tissue, to lungs, to kidneys, all those things, your body's got to constantly be regenerating. In this area, in this person's spine, their body is degenerating faster than it's regenerating. And that is a problem, right? How the body regenerates is through motion. So we've got to get these areas moving. We've got to get new blood supply in these areas. That happens. The best way to do that is through the adjustment. We utilize other technologies like PEMF. We have some specific exercises and other tools that we use to do this as quickly as possible. So if you go to the doctor and they tell you you have degeneration, it's because of old age, that is absolutely incorrect. It is not the cause, right? It does play a factor into it, but it is not the cause, because we can look at it here on x-rays. And I ask doctors this all the time, right? Why do we have this? When my parents would take me to their doctor's visits, I'd say, explain this to me. How is this degenerative and how is this not, if it's caused by age? And they can't answer the question because it's not the cause. So anyways, that being said, this person has a negative 12.7 degree curve. Normal curvature on our measurements is 34 to 43 degrees. Let me see if I can click off of this. This thing is going to make me work today, I have a feeling. This is the second set of slides that I want to show here. Let me get rid of these annotations. Why we take pre and post x-rays. This is when the patient started on the left. This is going to be a pre-x-ray, pre-care, right? We want to see what's causing the problem if it's spine related. This person had headaches. Why do we have such a high success rate with headaches? Is because your brainstem passes through here. This is your top bone, your atlas. That's approximately 72 trillion nerve fibers. Yes, 72 trillion. And this is second bone is where that brainstem transitions to the spinal cord. Keep going. I know this line's not 100% accurate. I'm trying to draw it freehand here. So where your spinal cord travels, these are where the spinal nerves exit through your spine, going to crucial organ tissues. These ones here at the base of the spine, these are going down to your arms, fingertips, through your shoulders. Here towards the top, we can see this going out to our cervical lymph nodes. The brainstem, this is going to be the one you hear chiropractors talk about the most. It's the atlas, protects 72 trillion nerve fibers. Common cause of headaches, migraines, allergies, sinus congestion, dizziness, ringing in the ears, ear infections, vertigo, fibromyalgia. Can literally, if that bone's broken, can shut down every function in your body. The opposite's also true. If we can get it in its correct position, can also speed up healing and increase the performance and function of the body. So you'll hear us talk about this one all the time. This person has a 0.1 degree curve. What happens? I keep doing this. This is my first time using these annotations, so bear with me. This person here, right, with that curve, what they are doing is they can stretch the brainstem or spinal cord by up to 7 centimeters just by not having this curve. That's why people have stiff neck all the time. That's where all your muscles, tendons, and ligaments attach, or the majority of them do. And for females, this is the one that comes up a lot, is they have this hump here and they don't like it, right? That's inflammation or swelling, right? It's caused by this lack of curve here in the neck. So for us, our goal is to get that back. We have tools. We're going to have a plan for that. This didn't happen overnight. You don't lose 34 to 43 degrees of curve in your neck overnight. That's why we have a plan, right? That's why we get results. If you want to go in, whenever you feel like it, get racked and cracked, hope that it works, great. That's your choice. It's your health. For us, those aren't the patients that we're looking for. We want patients that actually want to get this fixed, not only be asymptomatic, but also get this fixed so they never have to come back to their symptoms, headaches, migraines, allergies, whatever, so they can increase their quality of life as time goes on, barring a severe trauma. This is that same person over here on the right. This is 90 days later. In 90 days, that curve is starting to come back. You can see the indent on this side here, how it goes here, and then we indent, and then we come back up this way, right? We don't have that over here. This person has 11.2 degree. In 90 days, 11 degree change almost, or yeah, over 11.1 degree change. That is significant. That used to take us years to do that. At that pace, you'll have a healthy curve within a year. Her being in phase 1 degeneration, right? It takes approximately 20 years for that to happen. It can be accelerated from trauma or stress, but 11.2 in 90 days, that's amazing, right? Other thing that this patient did, they showed up to their appointments consistently. They did their homework consistently, right? We track that in our office. We base all of our stuff off the data in our practice, right? It's x-ray. You can't refute an x-ray. It's like, this is what happened. This is the results that we get. And then we know for what symptoms that we have a high success rate for, and for how much degeneration people have, what we have a high success rate for, what that timeline looks like. So for us, we're always going to be thorough. We're always going to be specific. So this person here, 11.2, headache's gone in 90 days. Let's go. Like, that's what gets me stoked, is if there's pressure on your nervous system, it controls every cell, muscle, tissue, and organ. Let's remove the interference first. That's fundamental. We can remove that, and then we can start adding other things. It takes a lot to be well-rounded in health. But if we can start there, that's going to set people up the best. And that's the easiest thing. You can just lay on a table and get adjusted. So name of the game, look at x-rays, precision adjustments. That's what's going to allow you to heal faster. And then in addition to that would be check in with those x-rays. So we do ours for our new patients at 90 days. And then after that, we do those every 12 months. Just like when you go to the dentist, they do it every 6 months. They're looking at those x-rays to make sure not only that your body is still healing or healthy, right? But they're also looking to prevent future problems. If there's something there, right? Much easier to fix it when there's no symptoms than to wait until those symptoms happen and or the degeneration and symptoms happen. And now we have to fight against time, right? Time and pain or symptoms. So let me clear out these drawings. Let's see if we can go to the next image. This person here, headaches again, just want to show it from a different angle. Negative 6.1 degree curvature here. So again, putting significant stress on that brainstem and spinal cord that passed through here. And then we can also see this is what's called an APOM, AP open mouth. We get the teeth out of the way here. This is the top bone, this bow tie shaped bone is the top bone in the spine. This top line is the base of the skull. So it's tilting to the left. And then we have rotation in the C2 here as well. And then we can measure the spacing. You can see more spacing on the left side here versus the right side. So usually a sign of rotation on that right side. And then so for us, you can see what happens is how the spine's starting to compensate. As we get down here, these dots, these are the bumps that you feel along the back, called your spinous process. These are shifting to that left side, right? The body compensates. You'll never see someone walking around with their head crooked like this unintentionally, right? Because your body has what's called a righting reflex, right? It's always trying to keep this top bone level because it protects 72 trillion nerve fibers. So the body adapts and it starts to compensate below that so it can keep that level and protect the 72 trillion, even though it compromises a few of the nerves here. If it has to choose between a few nerves or 72 trillion, it's choosing to protect the 72 trillion. Your body is very, very intelligent and it's very adaptive, right? So for us, that's why we see it. This isn't scoliosis, but we see a lot of scoliosis patients. A lot of times the cause of the problem is the top of their spine and the bottom of their spine, right? The middle is effect, right? Those are what we call compensations. It's not typically the cause of the problem. It is the effect, right? Kind of like if you have a heart attack would be an example. The effect would be the chest and arm pain, right? If you went into the ER and you were having a heart attack and they're like, oh my God, we've got to start massaging, rubbing, I don't know, CBD oil, biofreeze, right? We have to give them muscle relaxers. We'd be like, you're crazy. Like it's clearly a heart attack, right? This is what happens when I look at people's spines. It's like when doctors try to put people in rods, braces, and they don't look at this. And I know they're not taught this, but when you don't look at the top and the bottom, cause isn't always where the effect is, right? And that's something that's very common. We've known this for years, right? Is finding the cause. Doctor of chiropractic, that's why we say doctor of cause. We're looking for the cause, the root source of the problem. So let's move on from this one. This is a low back, another one of degeneration regenerating. So people are like, can it really regenerate? Yes. How do you know? We look at x-rays. Can't really see that disc here. Now we get here, this is a progress x-ray over here. We'll look at this. This is the low back, the L5 disc. Here I'm tracing the top part of this bone. And you can see the space opening in the front over here. Wow. Amazing. The body can regenerate. Yes. It's constantly regenerating every day. We just have to find the solutions that help the body regenerate faster than it's degenerating. So this person, through specific chiropractic, some of the exercises that we do, and PEMF technology that helps regenerate, get blood supply to those tissues, helps regenerate this, right? This is amazing. This is where I get stoked. It's like the body is so amazing. It's just finding a way to work with it. And this is why we have a great success rate. We're going to base it off of objective data. We're looking at x-rays. We're going to look at the data. We have forms in our practice that collect data. That's why we teach a lot of chiropractors too, is they want to know. They want to know what the success rate is for their practice. When they speak to patients, they want to be confident in what they're delivering. They want to be able to communicate effectively. And we also want to show patients that not just are you feeling better, but your body's regenerating. So we're preventing this from ever becoming an issue again, as long as we avoid traumas. Clear all the drawings again. We'll go back. I think I have one more image here. This is a great example. We talked about scoliosis earlier. Didn't put a measurement on this one, but you can see how amazing. You can't treat one area of the spine without looking at the rest, right? We've known this for years. I'm a big 49ers fan for the NFL. And there was a thing, a segment I was watching. They're like, oh my gosh, they just found out that you have to treat the neck for the low back. And I'm like, duh, like we've known this. Come on, guys. Like, think about it. Your body's a counterbalance, right? The top and the bottom, and they contradict. So this person here on the right side, this is their skull up here, and then their neck, their mid back, and then this is going to be their pelvis and their low back. Isn't it amazing of how it contorts the opposite way? It's a counterbalance. Your neck is a counterbalance to your low back. So if you lose that curve in your neck, it's more than likely you're going to have significant anterior pelvic tilt, right? If your hips come forward, your head comes back. If your head comes back, your hips come forward. Right? The same thing, typically what we see in scoliosis patients is the top part will be going the opposite way of the low back, right? And so that's why we unwind from the top and bottom. I'm going to grab a towel here and show you what I mean. This is my example. So if this hand over here is your pelvis, this hand over here with my lettering tattoos is your skull, right? What you can do, and right, you can massage this, you can do this, it's going to keep coming back. If you go to chiropractors that just make a bunch of noise, heard this, it's usually males that say this, oh yeah, I can bear hug them and make lots of noise. I'm like, cool, that's going to stop one of these days because there's other segments that are degenerating. You're just moving the hypermobile ones, right? And so this is why we don't do this. I could lay people on the table, rack, crack, hit the high one, feels really good, and then you just keep coming back for the same thing over and over again. What we do in our office by looking at specific x-rays is we're looking at the top and the bottom. Those are the areas with the most what's called dural attachments, or nerves attached to bones, right? So for us, instead of just pressing the middle, you just keep coming back. We keep doing the same song and dance over and over again. Is we want to unwind not just muscle tension, but nerve tension on your body by making correction at the top and the bottom. That leads to true correction over time. So I don't have to see you every single day for the same problems over and over and over again. And with that point being said, the other thing that x-rays show is with degeneration, that gives me a timeline of how long the problem's been there, right? I always tell people I'm a phenomenal chiropractor, a terrible magician. I don't just wave my hands over people and all their problems will magically go away in one visit, right? It takes time. If it takes time to get there, it's going to take time to heal. We heal people very, very fast. The body heals, right? We facilitate that. We do that very fast because we have a specific plan. And when we look at these x-rays, I'm not guessing where the misalignments are. I know exactly where those misalignments are. And we're going to make true correction. This person here, this is their sacrum, the bone in between your hips. 16 millimeter difference from left to right, right side. We know that sacrum is a big problem. And then 10 millimeter difference in left to right hip. And then 6 millimeters internal or rotational difference between the right and left hip. And then here, again, we're looking at cause. Here, this is effect, right? You can say that's not straight. This line should be going towards dots. It's caused by these top and bottom bones. As those start to get in their correct position, these bones will continue to shift over. And we have this patient under care. He's probably grown easily like 3 to 4 inches. He's a 18-year-old patient. So it's really, really cool to see that stuff. So for us, that's why we look at x-rays, right? That's why we do that up front. Always, and you'll hear me say the same thing over and over again when people are like, well, how much does it cost? What does care look like? I don't know. I don't know until I can see your spine. What's causing the problem? How severe the condition is? How long it's been there? If it's something that we're even going to have a success rate with. Once I know exactly what's causing the problem, if it's spine related, then I'm going to create a specific plan for you to ensure that we're going to get great success and great results. And then once I have all that information, I'll go over the finances with you up front so you know exactly what your time, energy, and financial investment is to get started, right? So there's no surprises. That's why I said we know you don't want surprises. But I can't see through your body. I can't see what's causing the problem until we look at x-rays and do a detailed exam. So that's why we're very thorough. That's what makes us Lexington's premier chiropractic facility is we're going to look at, and for us, I didn't go over it in this, this video, but we utilize digital motion x-ray studies in an instrument called the integrator. It's the torque release technique. So it allows us to make precision adjustments. We're the only place in Lexington that utilize that specific adjusting tool or instrument. And then, so once we have that and we make the precision adjustments, it allows us to help people heal faster. We have other things like PEMF that speed up the process. So our patients call it our premium plan. Why? Because it helps people heal the fastest, right? We're always looking to do it faster, right? But the time is always a factor when it comes to health. So we have those things in there, and then we're going to look at progress x-rays. We want to know that your symptoms are healing. We also want to know that your body is starting to regenerate back those tissues so we never have to come back where we started again. That's going to save people the most time, energy, and money over time. That's why we do what we do. That's why I love what we do. So if you guys have any questions, leave it in the comment section below. If you guys want me to create any other videos off of this, continue to do that. This was a video that one of our patients requested. We're going to do a separate video on sciatica. That's a common one that we see. Really, sciatica, neck pain, low back pain are the common ones. And then scoliosis are the big ones that we're seeing a lot of right now. We've also seen a lot of people, unfortunately, that have had surgical spinal fusions. Using that instrument allows us to help the segments above and below. We still get great results. Our goal, obviously, is to get to people before there's A, surgery, B, any degeneration. That's going to allow people to heal much, much faster. So if you guys haven't already, hit that like and subscribe, and I will see you all on the next video.